Hi, my name is John Bloomberg. I'm an EMT with 911 in New York State, and I'm CEO of Core Medical Systems. This is a series, or one in a series, of videos that we're doing on the Traveler Rescue Kit. And we're talking about all the life-saving equipment in the kit and how to use it to save a life. Today we're going to talk about oxygen and oxygen masks. This is your oxygen tank, and the oxygen tank has a gauge on it. Now when it's full, it will read 2,000. If you've been using oxygen and it gets down to about 500, you're going to want to start to replace it when it gets under 500. So just keep that in the back of your mind. One of the most important things to remember about this oxygen tank, and this will sound silly, but is if you're using it, lie it down. Because it always happens that someone comes by and kicks it, and when that happens, you'll break something on it, and we certainly don't want that to happen. But for now, I'm just going to leave it up like this because it's easier to see. Now, this is the tank, but you have to have a way to deliver the oxygen. So, the preferred way to deliver oxygen is with a non-rebreather mask, or an NRB as they call it. It's got a connector for the oxygen, it's got a bag that's going to fill up with oxygen, and it's got the mask itself with elastic that goes around the head. So the way we use this is we're going to take this and hook it up to the nipple on here, on the oxygen regulator. And we're going to push it on nice and tight. Now we're going to turn the tank on. And we turn this all the way on. Now this turns the tank on, but it doesn't turn the regulator on. The regulator controls how much oxygen comes out of the tank and into the mask. So we're going to deliver oxygen to an NRB at between 10 and 15 liters a minute. So we turn this dial up to 10. Now oxygen is flowing into the mask. But to inflate the bag, we're going to have to take and put our finger over this white end here. By pushing down on this, oxygen won't come into the mask, but it will fill the bag up. Once the bag is filled, now the mask is ready to put on the patient. Goes on like this, and the elastic goes over the head to keep it on there. We always turn the oxygen on first before we put it on the patient. We always turn it off after we take it off the patient. Now, when would we use a nasal cannula? We use a nasal cannula when we're trying to give someone oxygen, but even when the mask is on, the people feel like they're not getting oxygen, and that does happen to a number of people. They find it scary not to have access to the air in the room. Even though with this you're delivering 90% oxygen, with a cannula you're delivering about 30% oxygen. Room air is about 21% oxygen. So, we've taken care of the patient. We're stopping the oxygen. We turn this back to 0. We're going to turn the tank off. Now, there's no oxygen flowing anywhere. We're going to pull off the cannula, the NRB from the tank, but there's still oxygen in here. We've turned the tank off, but there's still oxygen pressing on the regulator. So we want to open this up, and it'll go shh, and let the oxygen out so we don't continue to press on the regulator. Turn this off, and now you're ready for the next one. Once again, when this gets below, the dial gets below 500, and you can check it by just turning this on, and that will show you how much oxygen is in there, even with this off. Turn this back off, and then let the pressure out, of course. Always keep it laid down. Once again, I'm John Bloomberg. I'm with Core Medical Systems. You can reach us, give us any feedback, any questions you have at 212-873-0105. Or send me an email at jjb@corecpr.com, or see us and our products, our Traveler Rescue Kit, on the web at www.corecpr.com. Thanks for joining us. Bye-bye.